You know, we always acknowledge our losses, but today is a milestone in America. We mourn 200,000 dead of the coronavirus, of our brothers and sisters, mothers and fathers. I just want to start with a moment of silence for the victims and their families. Thank you. And to the hundreds of thousands more that are still recovering, we wish them well. While some recover quickly and easily, others have an arduous process of weeks or months as they regain their health. Before we continue with today's update, I want to turn it over to our Lieutenant Governor to give a Native American greeting. We're going to be giving an update, among other things, on the impact of COVID in our Native American communities.
So good afternoon, everybody. Thank you, Governor. In the spirit of healing and education, we want to acknowledge the 48 contemporary tribes with historic ties to the state of Colorado. These include the Ute tribes, the Cheyenne and Arapaho nations, and many others. These tribes are our partners. We acknowledge their tribal sovereignty and respect them as tribal nations. We recognize these indigenous peoples as the original inhabitants of this land. So now I'll give it back to you, Governor.
Thank you, Lieutenant Governor. 654 positive cases in Colorado today. This is really an important update. You're going to get these numbers from Dr. Herlihy, our state epidemiologist, later. But we are seeing two things. One is significant outbreak among 18 to 25-year-olds, namely college students, and the bulk of whom attend University of Colorado Boulder, but there are a couple other universities that also have alarming info. There are other universities that have been able to have next to zero or zero spread of the virus. So we know it can be done. We know it isn't easy. We also know that there's a much lower hospitalization rate of the 18 to 25-year-olds, likely in the 1% to 2% range. Although, as I said to some student leaders the other day, and obviously a lot of this is about peer behavior and modeling, and it's important that the students themselves reach out to one another and act responsibly. You know, while 1 or 2% hospitalization rate is certainly far below the hospitalization rate for someone of my age, which might be 10% or so, somebody of Lieutenant Governor's age, which might be 25, 30%. And so it's really how it affects you depends on age. But even 1 or 2%, as I was telling these students, you know, that means if people are careless and go to a college party, you know, with 100 people, and it goes from 1 person to 80 people, as this virus would do, and in that kind of intimate environment with alcohol and close proximity, it's very likely that 1 or 2 people who attended that party will be in the hospital a week or two later. Most will make it out, but it's unpleasant. They could be in the hospital for days or weeks. And the fact that even somebody in their prime and young and healthy at a college party one evening, you know, 120 people at a party having fun, that's a big price to pay to have 1 or 2 that require hospitalization a couple weeks later. Now, the other thing we're seeing, and this is even more alarming, given the impact of the virus on people that are older than that 18 to 25 range, is there's also been an increase in over 25 across really every demographic, not necessarily related to the campus outbreaks, just a general increase. This is a warning sign for us, just as we had a warning sign in July, and we were able to correct course. This is a warning sign for all of us that, again, while generally what we're doing is working, we need to do it a little bit better. We need to be a little better with the mask wearing, avoiding large groups, being smart, being careful, right? Not being fearful, not being anxious, just being cautious, smart, careful. You know how to do this by now. I've you know, not just said it myself a number of times. You've hopefully read it in trusted publications and media. Wearing masks around others, staying at least 6 feet from others whenever possible, washing your hands regularly, avoiding large groups, keep it to 10 or less, right? Avoiding parties, avoiding large groups. This is how we contain this thing. And I think the message today is we're not, once again, and there was a period in July where we faced this, we're not doing quite well enough. We need to do a bit better, and that's for the next several months, right? We there already are some promising therapies. There's vaccines being tested. It's not forever. We can all live fulfilling lives. We go to work. We go out to eat. We hang out with a couple friends. But it just means, instead of 30 friends, you hang out with 3 special friends, right? Outdoors where possible instead of indoors. Today's the first day of fall in Colorado. Traditionally, a month or two of some of our very best weather for being outdoors. Let's let that wonderful Colorado weather be a weapon for us against the virus, which spreads more in indoor environments with limited circulation. So if you're going to associate with others or hang out with others, better to do it outdoors. Best to be outdoors when you can. We all have to be indoors. Many of us work or go to school, and I have meetings indoors too. Masks are very important, and then distancing where possible. And we'll get through this. So it's really a challenge based on the data that Dr. Herlihy will present to you. Let's step it up. Let's step it up over the next couple of weeks. Let's not have a big third wave of this here. Let's stamp this out. The college situation is one thing. Where the health risk for the 18 and 25-year-olds is less than it is for older Coloradans. And the institutions are working with their county health departments to take the steps they need to contain the spread at the campus level. But most importantly, it's on us. It's on us whether you're a 19-year-old student at CU Boulder, whether you're a 72-year-old retired Coloradan, or whether you work every day in downtown Colorado Springs or Denver. It's on us. And we need to step it up a bit to continue to make sure that Colorado is a reasonably safe place to live and work and play during the biggest global pandemic in a century. We are now at 66,000 cases. We have lost 1,926 Coloradans due to COVID. And the general trend has been an increase in COVID in our state. In fact, 12 of the last 14 days, and hospitalizations, 8 of the last 14 days have gone up. Again, you will see less hospitalization from that 18 to 25-year-old group, so we're grateful. The danger is the community spread. We know that college students generally associate with one another, but many of them have jobs or work in the community. We're particularly concerned if they work in food services or retail, encountering many others. Hence, again, the supreme importance of mask wearing, both for those working in stores and restaurants, as well as for patrons in stores and patrons in public areas of restaurants. Obviously, when you sit down at a table, preferably outside where it's safer, you obviously can take your mask off to eat. So let's get through this. Let's step it up. I know we can do it. I know we're all tired. We're tired of the virus. The virus is not tired of us. I'm confident we're past the halfway point on this terrible, challenging time, but it ain't over yet. Let's step it up. Let's save lives. Let's keep our economy growing. Now, as we've seen in a number of areas, the pandemic is magnifying some of the existing inequities in society. And one of those is the impact the virus has had on our American Indian and Alaskan Native populations. Now, that is both here in the Denver, Colorado Springs area, where we have tens of thousands of Native Americans, also in our tribal nations, and I will be in Southwest Colorado in the next few weeks discussing the particular impact on our areas. Nationally, American Indian and Alaskan Natives have been disproportionately affected by both hospitalizations and deaths. So if they're experiencing 5 times the hospitalization rate, 40% more deaths than Caucasians. As an administration, we're doing everything we can to reduce these inequities. The majority of American Indians in Colorado actually live in urban areas. So they live in Denver, Colorado Springs, Boulder, Fort Collins, suburbs, exurbs. And our Department of Public Health and Environment partners with the Denver Indian Health and Family Services to provide free testing for the Native American community. To give an additional update on these efforts, I'm turning it over to Lieutenant Governor Diane Primavera. By statute in Colorado, the Lieutenant Governor of Colorado is the chair of the Colorado Commission on Indian Affairs. And in her time as Lieutenant Governor, Diane Primavera has jumped into that, taken it extremely seriously, visited our tribal nations many times, been to powwows before the pandemic. I went to one. I think she's been to a couple, and was able to partake in the congregation of people from tribes across the American West. We're thrilled to have with us Lieutenant Governor Diane Primavera.
Thank you, Governor. Well, first of all, I want to acknowledge, and I'm really happy, that Lucille Echohawk from the Colorado Commission of Indian Affairs at-large board member and the former executive director of Denver Indian Family Resource Center has joined us here today. It's great to see you. We also have Adrian Maddox, executive director of the Denver Indian Health and Family Services, joining us today. And it's my understanding that Rick Waters, who is the executive director of the Denver Indian Center, was here earlier but had to leave. At the beginning of 2020, no one imagined the impact that COVID-19 would have on our lives. The pandemic presented unique challenges, and it exposed and exacerbated existing disparities in our society, including disparities in our healthcare system. As the governor said, the American Indian and Alaska Native communities have been disproportionately impacted by the pandemic and its cascading effects. In response, the governor and I, our staff moved quickly to strengthen lines of communication with communities across the state. I've been convening regular meetings with the Ute Mountain Ute and Southern Ute Indian tribes since the onset of COVID-19 in Colorado. My staff and I have also met regularly with frontline organizations serving American Indian and Alaska Native communities living off tribal lands along the Front Range, including the Denver Indian Health and Family Services, Denver Indian Family Resource Center, the Denver Indian Center, Spirit of the Sun, American Indian Academy of Denver, Four Winds Indian Council, Native American Services Outreach at Colorado Coalition for the Homeless, and the Denver Public Library. This regular communication has been and continues to be crucial in identifying valuable opportunities for partnerships amongst these organizations and with state agencies to support our COVID-19 response efforts. It's also produced unique solutions with other partners across our state and helped identify and address barriers to service. For example, the Colorado Department of Public Health and Environment has partnered with the Denver Indian Health and Family Services, as the governor said, to provide free COVID-19 testing for community members. The Denver Indian Health and Family Services provides culturally responsive care for American Indians and Alaska Natives and is the only urban Indian health organization in Colorado. Additionally, the Colorado Department of Public Health and Environment has partnered with the Denver Indian Center to form a COVID-19 Native Response Team. The Denver Indian Center is an urban cultural gathering center for the American Indian and Alaska Native community of the Denver metro area. The COVID-19 Native Response Team is made up of community members who've been trained in crisis counseling to provide resources and mental health triage. The Colorado COVID-19 Relief Fund, used to assist and any nonprofit, school district, municipality, tribal organization, or business is helping our most vulnerable being impacted by COVID-19 and has granted $165,000 to several American Indian and Alaska Native organizations, including the Denver Indian Center to support their food bank and operations, the Denver Indian Family Resource Center helping to strengthen Native families by providing assistance with COVID-related needs depending on the needs of the individual or family, Four Winds American Indian Council and their food bank, and Herbal Gardens Wellness supporting Native communities. Within my office, I directed the Colorado Commission of Indian Affairs to reorient the Health and Wellness Committee to focus on addressing the impacts of the COVID-19 pandemic in the community. We convened state agencies, non-governmental agencies, and American Indian and Alaska Native community members to identify strategies to support the community. The committee prioritized developing culturally responsive public service announcements and other materials to help educate the community on COVID-19 testing, hand washing, face coverings, which the governor and I are wearing, and the importance of mental and behavioral health care. Adrian Maddox, Executive Director of the Denver Indian Health and Family Services, and Catherine Redhorse, Executive Director of the Colorado Commission of Indian Affairs, co-chaired the committee, ensuring that these efforts were Native-led and Native-designed public education campaigns. I'm excited that Adrienne Maddox is joining our press conference this afternoon, and for her to tell you all more about the amazing services that the Denver Indian Health and Family Services provides to community members. So I look forward to continuing our conversations and identifying innovative partnerships to support the incredible work that these organizations are doing. Adrienne, I think you're up.
Sorry, I was struggling
That's
with my
okay.
mask.
They're tough.
Thank you for the opportunity to speak today about the impact of COVID-19 in our American Indian community. I am the Executive Director of Denver Indian Health and Family Services, and I'm also an enrolled member of the Hopi tribe in Arizona. Denver Indian Health and Family Services' mission is to provide culturally competent services that promote health for our American Indian Alaska Native families and individuals in the metropolitan Denver area. We are one of 41 urban Indian organizations across the United States funded by Indian Health Service. We were established in 1972 following the termination era by Congress to fulfill the federal government's health care related trust responsibility for Indians who live off reservations. Today, more than 70% of Native people live in urban areas. Our clinic provides primary care, behavioral health, dental, pharmacy, enrollment services, and diabetes prevention and management. We have over 7,500 registered patients in our database. Through September 2020, we have tested 443 individuals for the virus and 15 were positive. Colorado Department of Public Health and Environment reported through August 2020 that there were 294 American Indian deaths and 19 were related to COVID-19. Our population continues to die at higher rates than any other Americans in many categories, with the higher rates of diabetes, heart disease, and other chronic conditions. Our community faces an increased risk of severe health complications due to the virus. Across Indian country, factors such as food insecurity, fresh water, lack of access to health care, and struggles of obtaining the proper PPE to provide services to families that need it have been lacking, and our communities have been underprepared and devastated. So I want to express my gratitude to partners that have provided direct support to our organization throughout the pandemic. Colorado Commission of Indian Affairs, Denver Indian Center, Denver Indian Family Resource Center, our state tribal liaisons, Project Mosaic, and along with other agencies such as Lockheed Martin, whom Lieutenant Governor Primavera connected us with, and our relationships with Direct Relief, Project Cure, Indian Health Service, Colorado Department of Public Health and Environment, Denver Public Health, and the Colorado Safety Net Collaboratives for donating essential PPE, which allows us to keep our frontline workers safe so that we can continue to take care of the families that we serve. The pandemic has profoundly impacted individuals across Indian country. The CDC released a study that examined how the pandemic affects American Indians, which are at the highest risk of the disease. CDC found that in 23 selected states, cases among the Native population were 3.5 times that of non-Hispanic whites. The Colorado Commission of Indian Affairs COVID-19 Committee teamed up with Project Mosaic to form a campaign that included the Ute Mountain Ute Tribe, Southern Ute Tribe, and organizations that serve the Native American community. Project Mosaic is a Native American-owned and operated consulting group who helped us strategize a communication approach in a coordinated manner. And that was to reduce mistrust and fear, build community, leverage cultural strengths, and promote healthy norms of behavior consistent with Native American culture. Our partnership organized and launched a campaign to inform individuals of COVID-19. The committee created 5 subcommittees that included communications, data gathering, basic needs, education, health, and mental health. The priorities of the subcommittee were to create a branding approach in a CCIA branded mask, which we're all wearing today, and 10 infographics designed by Walt Poyer of Nakota Designs. To produce a PSA showing the ease of COVID testing at our clinic, and to explore the feasibility of a 211 hotline specifically for the Native community. As we navigate this pandemic, we will continue to address COVID-19 and to keep our families safe and informed. As a co-chair of the Colorado Commission of Indian Affairs Health and Wellness Committee, I express my most profound appreciation to Governor Polis, Lieutenant Governor Primavera, Colorado Commission of Indian Affairs, our tribes and community partners for their participation in this extraordinary campaign.
Thank you, Adrian. You know, this virus affects everybody as part of that. You know, Native American, Black, Latino, Asian American, white, whether you live in Sterling or Montezuma County or Fort Collins. It's here, it's in our community, and we need to be smart to avoid additional fatalities, to be able to move forward with building back and growing our economy. And most importantly, to prevent additional loss of people that might be close to you. It could be your own brother, sister, aunt, or uncle, mother, or father. It could even be your own life that you save by avoiding large gatherings, by wearing masks, and being careful and being smart in these next few months. I know this takes a tough toll on all of us. Some that means a tough toll economically. Others have their jobs and are doing fine. Some it means a tough toll psychologically, spiritually. Humans are a social animal. We love to be together. And we can, in many ways, be together carefully in this pandemic, going camping a weekend with one other family, or having a few people over, 3 or 4 people for dinner. But we really have to avoid those large gatherings. We'll be able to, of course, resume them with gusto at some day in the future. But in the meantime, we want to make sure that you're there, I'm there, your loved ones are there to celebrate that day. Now, I want you all to see the same data that we see. Dr. Herlihy, our state epidemiologist, will provide an update on the latest information so you can see these trends in Colorado. I fully trust you to react accordingly, to be smart, to be safe, but I want you to have really all of the data every day that we use for decision making is at covid19.colorado.gov. But Dr. Herlihy has prepared a few highlights so you can see exactly where we are with regard to the fight against the deadly virus in Colorado. Dr. Herlihy.
Thank you, Governor. Good afternoon. Next slide. So as I shared with you last week, we were seeing a gradual increase in cases in the state. And you can see that represented on this figure. The last 2 weeks, you can see we saw an increase of 2% and 6% week over week. Again, if you look at this figure, the weeks where we see an increase are shown in red. The weeks where we see a decrease are shown in blue. What you can see for this past week, though, however, is a very substantial increase, an acceleration of disease transmission occurring in the state, as represented in this figure. Next slide. And as the governor explained to all of you, we know that much of this disease transmission is occurring among 18 to 25-year-olds and is occurring among college students. But we know that's not the entire picture. But I think it is important to acknowledge here that we are seeing really that rapidest increase among those 18 to 25-year-olds. And that's really been for the last 2 weeks in the state. Next slide. However, if you look at cases in the state, excluding 18 to 25-year-olds, you'll see that even among other age groups, we're again seeing rapid acceleration of this virus in the state. So you can see week over week, we saw a 45% increase in cases last week. So that's certainly a very concerning trend for us. So as I mentioned, the greatest rate of acceleration is in 18 to 25-year-olds, but in all other age groups, we're also seeing a level of increase at a pretty rapid rate. Next slide. So one of the things that we do to evaluate how much of our increase is due to increased testing is to track percent positivity. So the good news in this figure, if you look at the most recent week, you'll see that we did substantially increase the amount of testing that's occurring in the state. And so that's certainly great. We're working closely with our college university partners and with our local public health agencies to make sure that students on campus have access to testing, and that, of course, Coloradans around the state of all age groups have access to testing. And so in the last week, we have been able to increase testing in the state. But if you look at the red and blue bars at the bottom here, you'll see that at the same time, we have seen an overall increase in our percent positivity. So in the setting of increased testing, when we see an increase in percent positivity, that's an indicator that we are seeing a true increase in the amount of disease transmission that's occurring in the state. Next slide. As the governor mentioned, we recognize that 18 to 25-year-olds are much less likely to be hospitalized. We certainly do see hospitalizations among that population. So thus far, we have really seen a relatively stable trend in our hospitalization data. So that 7-day average has minimally changed in the last week or two. And we certainly hope that continues. But we do know that hospitalization data can lag behind some of our case data. So this is certainly a trend that we're going to be paying close attention to over the next couple of weeks to see if, as we see additional transmission potentially outside of that 18 to 25-year-old population, could we see a spillover into other age groups and potentially an increase in hospitalizations in the state. Next slide. Wanted to share some age-specific trends with you. So I shared this data with you last week. One of the things that we're highlighting here is obviously the substantial increase that has occurred among 18 to 25-year-olds. That's shown in the lightish green colored bar that is really at a much higher rate of disease transmission than the other age groups. But I think it's equally important to recognize that we are seeing an overall increase in all age groups, and that's what that figure shows you. So obviously the most substantial increase occurring among 18 to 25-year-olds, but increases occurring among all age groups in the state right now. Thank you.
So look, what can you do? In addition to being smart and being safe, wearing a mask, avoiding large gatherings, washing your hands, if you have symptoms, if you have a sniffle, a cough, a fever, get tested. It's free, it's quick, it's easy. There's over 50 sites across the state, covid19.colorado.gov. Some of the free, quick, and easy sites in major metropolitan areas include the Aurora Sports Park, Water World in Federal Heights, Pepsi Center, Citadel Mall in Colorado Springs, Pueblo County Fairgrounds, Mesa County Fairgrounds. There's 2 in Boulder, Stasio Fields, and 1 on the Hill. Walk in, one of them's drive-in, you're done in 15 minutes, free, quick, easy, get the results in a day or 2. Really important to for us to be able to contain the virus, and for you to know whether in fact you might be a deadly threat to your own housemates, friends, neighbors, or family, or whether it's simply a passing cold. So if you're experiencing symptoms, get tested. The testing isn't limited to those with symptoms. If you think you were exposed a week ago, again, doesn't do any good to go in a day or 2 after you're exposed. You don't have it yet. But if somebody coughed on you, a loved one had it, you think you might have been exposed, you go in 7 or 8 days after the exposure and get tested to see if you've contracted it yourself. Before we close, I just want to talk a little bit about housing and some of the recent steps that we've taken to ensure Coloradans are stably housed during the pandemic. We created a eviction prevention task force, and they've met twice already, making recommendations to discuss the new CDC federal order, recommendations for Coloradans, next steps to keep people housed. In light of the recent federal notice on evictions, what we did today is we amended an executive order to include a notice requirement that makes sure that tenants are notified of their rights under the CDC anti-eviction order. So there's a notification piece of that landlords will provide to tenants in our state. Since launching 2 programs that help people with financial need due to COVID-19 pay their rent or mortgage, we've given $7.49 million out in rental and mortgage assistance. The HelpColoradoNow.org COVID Relief Fund, which has raised over $20 million, has also prioritized housing assistance through community partners across the state. Last Friday, through our property owner preservation program, where landlords apply on behalf of their tenants, the Division of Housing distributed $5.2 million to more than 4,000 households to allow them to stay safely in their home and not be evicted. And through our emergency housing rental assistance program, we distributed $2.36 million to over 1,000 households. So a lot going on. No doubt a lot more. That's why we convened the task force. The notifications will help. The additional aid will help. But we of course, extend our sympathy not just to the families of the victims of the virus, but to the victims of the global recession that has also occurred in the wake of the greatest pandemic in a century. Thank you for joining us today. Be smart, be careful. Let's do a little better, Colorado. And happy to answer some questions.
Go ahead.
Governor, earlier this month we saw there was an economic forecast that said things were looking good for the state and that we wouldn't need cuts. Now we know that furloughs are planned. Can you tell us why now, and do you know exactly how much you'll save because of this?
Well, I appreciate your optimism that there was somehow a forecast showed there wouldn't need to be cuts. The forecast showed that there needed to be billions of dollars in cuts, both the legislative forecast and ours. Very tough budget year, this year and next year. I think what the glass is half full was it wasn't the worst case scenario that people were worried about. We are seeing a recovery, but our unemployment rate is still, I think, 6.7%. It was in the twos before the recession. So we absolutely, it's a time for belt tightening, and families are tightening their family budget. Many folks have lost hours that they work. Others are worried about losing their jobs. There's more Coloradans unemployed. The public sector, too, needs to tighten its belt to get through this. And we extended that furlough program today as a way to save millions of dollars of taxpayer money and make sure that we can minimize interruptions to important state services.
David Clue over at Denver 7. Given the sharp rise in the number of COVID cases in Boulder County, the majority of the cases mentioned are connected to the university. And given the huge impact it could have on businesses that are doing the right thing in Boulder County, what can or will the state do in response?
So right now, there's not yet evidence that the student outbreaks have led to greater community-wide outbreaks. That is at the top of the list of our concerns because we know that while college students are generally part of the campus environment, many of them do work in the community. We want to make sure that no person in Colorado, but particularly where there are outbreaks like at CU, go to work if they are exhibiting any flu-like symptoms, particularly in retail or food services, get tested. We've worked closely with CU and Boulder County Health to step up testing with both the testing that the university is doing in the dorms, as well as the two free, quick and easy sites in Boulder so that people can immediately be identified and, if necessary, quarantined. So I think it's really important that every college in our state take this seriously. Many are doing well. We have next to zero cases or I think zero in the last week at Fort Lewis and Durango Residential College, very few at UNC and Greeley. Last I checked, our entire community college system with 120,000 or so distinct students, not all of them full-time, only had 6 cases as of last week. So we know that it can be done, and we look forward to working with the University of Colorado, their president, their chancellor, and their regents to help contain the outbreak before it spreads to the broader community, both in Boulder County as well as across the state.
Another question on the furloughs. The JBC says